Welcome to the Physio Rooms Woodvale. Today we are going to be sharing our top 5 tips for managing anterior knee pain.
Okay, tip number 1 is to assess quadricep strength. Now, a lot of people make the mistake of thinking their quads are pretty strong because they feel good with a squat or a lunge or something similar to those functional exercises, but unfortunately these ones don't isolate the quadriceps. So a great way, that's one of our favourites to assess quadricep strength, is on a knee extension machine, loading some weight up and comparing side to side. And this gives you a nice good indication of if one side's a lot weaker than the other, and it's also something you can measure at a later date. So this leads us straight into tip number 2, which is improving quadricep strength, particularly if you found a difference on that assessment. So this can be with the leg extension machine as well, loading it up with a good 8 to 12 reps each leg, or it can be incorporating it into other exercises that we mentioned before, like squats, lunges and step-ups. Having said that, it's always good to find an exercise that will isolate the quads as well, so that you know you are specifically working on them too.
Okay, so tip number 3 is strengthening the hip and the bum muscles. Obviously there's a whole heap of these exercises that are out there, but Ash is going to demonstrate one of our favourites, which is just a variation on a crab walk using a medicine ball.
Tip number 4 is taping the knee. Now, there's many different ways you can tape for knee pain, and it depends on what the knee injury is. But the point of taping is, first of all, that it can reduce your pain. Secondly, it can change the way the knee is loaded or the way it moves. And thirdly, it can help with people who may be having trouble with some of the loading exercises we're getting you to do. Taping it can just help you assist you with doing those exercises a bit more easily.
So our final tip, which is tip 5, is about load management. Now this can take many forms, but essentially what it means is doing a certain level of activity without aggravating your pain or symptoms. So for example, it may well be still going to training but just doing the warm-up and the skills part of the training rather than doing the game side of things. Or even, let's say, if we're using the leg extension machine as we demonstrated earlier, working just through a certain range of knee movement rather than through the full range. Basically, any activity can be modified so that you can still exercise without bringing on too much of your symptoms.
And that's our 5 tips for knee pain. Guys, thanks for watching today. If you have any questions about your knee pain or you want to make a booking, just give us a call on 9309 5805.